If there is one conversation I wish more women had with their doctors after 70, it is not, what test should I do next? It is, do I actually need this test? And what happens if it finds something? That question can change everything, because by the time many of us reach our 70s, we have been trained to believe that more testing always means better care. More scans must be safer. More screening must be smarter. More monitoring must mean we are being responsible. And I understand why that sounds comforting. It feels proactive. It feels like we are staying ahead of things. It feels like we are protecting ourselves. But sometimes more medicine is not more protection. Sometimes it is more worry, more procedures, more follow-up, more confusion, more side effects, more fear. And for older adults especially, that matters. Now let me be very clear before we go any further. I am not anti-doctor. I am not anti-testing. And I am certainly not telling you to ignore symptoms or skip medical care. If you have chest pain, blood in your stool, sudden memory changes, unexplained weight loss, a new lump, a fracture, or anything concerning, please get checked. Truly. What I am talking about today is something more nuanced and honestly, more important than most people realize. I am talking about routine screening and testing that may no longer make sense for every person just because of age, habit, or fear. That distinction matters so much because here is what often happens. A woman goes in for a regular appointment. She feels mostly fine, maybe a little tired, maybe a little forgetful. Maybe she just wants reassurance. A test is ordered. That test finds something unclear. Now there is another test, then a referral, then a procedure, then maybe a medication, then side effects, then anxiety. And before she knows it, her life has narrowed around something that may never have harmed her in the first place. I have seen this pattern up close, and I know how easy it is to get swept into it, especially if you grew up believing that the good patient is the compliant patient, especially if you do not want to seem difficult, especially if medical conversations make you nervous and you just nod along because everyone in the room sounds so certain. But after 70, wisdom matters as much as vigilance. And one of the wisest things you can do is learn how to ask better questions before you say yes. Today, I want to walk you through 5 common tests or screening situations that deserve a second conversation after 70. Not because they are always wrong, not because they are never useful, but because context matters, symptoms matter, your overall health matters, your values matter, your goals matter. And I want you to feel calm, informed, and empowered enough to pause before you automatically agree. The first one is cardiac stress testing in someone who feels generally okay and does not have clear warning signs. Now, if you are having real symptoms like chest pressure with exertion, shortness of breath that is new or worsening, or something that feels truly off in a cardiac way, that is a different story. But sometimes an older adult mentions being a little more tired on hills or a little less energetic than she used to be, and suddenly the next step is a stress test. Then, if anything looks questionable, that can lead to more invasive follow-up. The problem is that not every abnormal result means dangerous heart disease, and not every finding needs a procedure. In older adults, the body changes. The tests are not always crystal clear, and what starts as reassurance can turn into a whole cascade. I want you to remember that fatigue has many causes: poor sleep, anemia, dehydration, low fitness, medication side effects, grief, undereating, overstress, thyroid issues, blood sugar swings, being 74 and not 44. Those things matter too. So if someone suggests a heart test when your symptoms are vague or mild, it is okay to ask, what are you looking for? How likely is this test to change what we do? Is there a simpler first step? That is not being difficult. That is being thoughtful. The second one is brain imaging for mild forgetfulness. This one hits close to home for so many women because memory changes are frightening. You forget a word, misplace your glasses, walk into a room and forget why you are there, and immediately your mind goes to the darkest place. Is this dementia? Is this Alzheimer's? Is something terrible happening? I understand that fear so deeply. When our minds feel less sharp, it can shake our sense of self. But mild memory lapses do not always need a brain scan right away. Sometimes stress, poor sleep, depression, menopause history, loneliness, medication effects, hearing loss, dehydration, low B12, thyroid issues, and simple aging can all affect memory and focus. And imaging can sometimes reveal age-related changes that sound alarming, but do not actually explain the symptom or require treatment. What breaks my heart is how many people hear a vague phrase from a scan report and then spend months terrified. So before rushing into imaging for every little memory wobble, it is reasonable to ask whether the first step should be a thoughtful cognitive assessment, medication review, labs, sleep review, or evaluation of how you are functioning in daily life. Are you paying bills, following recipes, driving safely, managing conversations, living your life? That fuller picture matters so much more than panic. Again, I am not saying never do the scan. I am saying let the scan fit the story. The third one is colon cancer screening, especially colonoscopy after a certain age. This is a perfect example of how medicine changes with life stage. Earlier in adulthood, routine colon cancer screening can be very helpful. But later on, especially after 75, the question becomes more individualized. What is your prior screening history? Have past tests been normal? Do you have symptoms, family history, new bowel changes, bleeding, weight loss? Are you robust and healthy or medically fragile? These details matter because the prep for colonoscopy is no small thing in older adults. The dehydration, the disruption, the sedation, the recovery, all of that carries more weight than it does at 52. And if you have already had normal screenings and no warning signs, the balance can shift. Sometimes a less invasive option may make more sense. Sometimes no further routine screening may make sense. Sometimes colonoscopy is still absolutely the right call. The point is that after 70 or 75, this should not be autopilot. It should be a conversation. And I know some of you needed to hear that because there is a certain kind of pressure older adults can feel in medicine, as if saying yes to everything is the only safe choice. But a thoughtful no or a thoughtful not yet can also be wise. The fourth one is whole body scans or broad imaging done just to make sure everything is okay. These can sound so appealing, can't they? Just scan me from head to toe. Give me peace of mind. Tell me nothing is wrong. I completely understand the desire, especially if you have lost friends, watched family members get sick, or felt let down by the medical system before. Reassurance becomes very tempting. But broad imaging in someone without symptoms can open doors you never meant to walk through. Tiny nodules, incidental cysts, benign-looking spots, age-related changes, things that might never matter, but now they are on paper, and now everyone is chasing them. More scans, more referrals, more biopsies, more worry. I want you to imagine opening every drawer in a house that has been lived in for decades. Of course, you are going to find odd little things. That does not mean the house is falling apart. Our bodies, especially older bodies, are full of stories. Not every scar, spot, or shadow is a crisis. So if you are being offered broad imaging without a clear reason, pause. Ask, what problem are we trying to solve? What if you find something incidental? What are the downsides? Will this improve outcomes or just increase follow-up? That is wisdom. And the fifth one, which may surprise some women, is bone density testing and the reflex to medicate every lower score without looking at the whole woman. Now listen, bone health matters. I talk about it all the time. Strength matters. Balance matters. Falls matter. Fracture prevention matters. I am not dismissing that for 1 second. But I have seen women become terrified by a number on a scan without anyone sitting down and explaining the bigger picture. A scan is one piece of information. It is not your destiny. What matters too is whether you have fallen, whether you have fractured, whether you are strong, how steady you feel, whether you do resistance training, whether you get enough protein, calcium, vitamin D, and sunlight when appropriate, whether medications are affecting bone, whether you smoke, whether you are frail, whether you have lost height, whether your muscles are protecting you. Sometimes the most protective thing for bones is not panic. It is strength. It is stability. It is nourishment. It is getting up from the chair more easily. It is carrying groceries. It is doing your balance work at the kitchen counter. It is building a body that can catch you before the fall. And yes, sometimes medication is appropriate. Absolutely. But it should feel like a considered choice, not an automatic response to fear. When I work with women in this season of life, this is what I come back to again and again. Health is not just about finding disease. It is about preserving function, energy, mobility, peace of mind, and quality of life. That is why these conversations matter, because too often older adults are treated as if the goal is to chase every possible abnormality forever. But many of you are not asking for endless medical drama. You want to stay sharp, stay strong, stay independent, stay connected, sleep through the night, enjoy your grandchildren, walk without fear, travel if you want to, garden, dance, read, cook, laugh, live. Those are worthy goals, beautiful goals, real goals, and every test should be weighed against them. Will this help me live better? Will this change management in a meaningful way? What happens if it finds something? What happens if I do nothing for now? What are the risks of the test itself? Are there simpler options first? Does this fit my age, my health, and my values? Those questions can protect you from so much. I also want to say something for the women who feel intimidated in medical settings. You are allowed to slow the conversation down. You are allowed to say, I need you to explain that in plain language. You are allowed to bring someone with you. You are allowed to write your questions down. You are allowed to go home and think before booking a non-urgent test. You are allowed to ask about watchful waiting. You are allowed to ask whether a recommendation is based on your symptoms, your risk, or just routine habit. You are not a burden for needing clarity. You are not rude for wanting context. You are not irresponsible for asking whether more is actually better. You are being wise. And I think that word matters more than ever after 70. Not fearful, not passive, wise. Because prevention is not only about screening. Prevention is also strength training, walking, sleep, protein, social connection, medication review, blood pressure management, balance work, hearing care, hydration, nourishing food, sunlight, purpose, managing blood sugar, protecting your muscle, protecting your peace. That is prevention too. Sometimes the quiet kind, the kind that does not make headlines, the kind that happens in your kitchen, on your walking path, in your bedtime routine, in your weekly exercise, in the questions you ask before saying yes. Modern medicine is a gift. It truly is. But more is not always better. And after 70, thoughtful medicine often matters more than aggressive medicine. So if you take one thing from today, let it be this. Do not assume that every test being offered is automatically the right next step for you just because it exists, just because it is common, or just because someone says, we usually do this. Pause, ask, understand, choose with care, because your body is not a checklist. Your life is not a scan report. And your health is about more than detecting every possible thing that might someday happen. It is about protecting the life you are living now. Age is just the beginning, my love. You have spent your whole life caring for others. It is time to care for yourself. And that includes learning when to say yes to medicine, when to ask for more information, and when to honor a calmer, wiser path. Vibrant doesn't have an age limit, and neither does discernment.